We are so pleased to have with us Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Good morning, everybody.
It is so good to have you with us today. What are we going to talk about? By the way, I hope you and your family had an amazing Christmas, and everybody at Okoboji Wellness Clinic. Now, as we head into the new year, I don't even have any idea what we're going to talk about today.
Well, I thought it'd be a good time to just to reflect back a little bit on the last year and then look forward a little bit. I sat down with the team a couple of weeks ago, and it's always fun to think of the progress because we're blazing new trails always here, and trying to be at the where we want to be from a leading the tip of the spear, so to speak, I guess we'll say. But when it comes to finding new ways to solve problems, and we always talk about the tool belt, and over the course of the last 4 to 5 years at the Okoboji Wellness Clinic, that tool belt continues to get bigger. And last year, we absolutely increased that tool belt in a significant way. And so I'm really grateful to have such a good team that is hungry and excited to learn new things, because when you add new things, it stretches everyone. And but we doubled the modalities that we offered in the last year, which when I looked at that, I'm like, wow. When we came into practice, we were working so much with COVID and ivermectin and nutrition. Nutrition is absolutely foundational, and hyperbarics, of course, being our big piece. And from there, we've continued to add. This last year, we added ozone therapy, which was an absolute blessing to so many folks in the area, and we continue to scratch the surface with the potential of ozone therapy and all the different ways that it can apply. But one quick example is, again, a gentleman that prior years, we touched on this in the past, had ended up in the ICU with cellulitis, and we did some ozone bagging of his legs, ozone is 3 oxygen molecules, and we circled his legs with this high-intensity oxygen, and he was able to stay out of the ICU. So stories like that, the lady that came up from southeast Iowa with significant symptomatic rheumatoid arthritis, and IV ozone therapy for her for inflammation and pain was an absolute game changer. So the ozone was a big thing this year. We added eye-assist neurofeedback for those that struggle with anxiety and depression, PTSD, traumatic brain injury. We've gotten into metabolic testing with the PNOE device out of Greece, and that is testing your thyroid, which is often missed. And most folks told their thyroid numbers look normal, but their thyroid is actually not normal. So we can test that with this resting metabolic test, where you sit in 10 minutes, put a little mask on, measures your oxygen in, your carbon dioxide out, and we're able to actually get a biological age on you versus your actual age to see how you're aging, check your heart and lung and brain health with this device as well. And then the other big thing we touch on, Dave, over the year especially, is mitochondria. Mitochondria make our energy, and this device is fantastic at measuring your mitochondrial health. So when the mitochondria is happy, we tend not to be in the state of illness or sickness. 2 other big things, the MDI, microdose infusion, has been another game changer for us this year. It's called an artificial pancreas. I've not touched on it at all. It's a bolus of insulin therapy, and we've been using it to treat things that range from congestive heart failure to brain health to wounds to neuropathy. It's been huge for where folks have numbness, tingling, and that is being resolved for many of these folks with this treatment. IV True Dose, which is a platelet therapy, is one of the most recent things that we added. And it's about a 2-hour treatment, IV treatment, where you take your blood out, we spin it, and we put your platelets back in. And that is like an immune army that's going out there to activate and stoke that immune system. And so that has absolutely been a game changer. Of course, with those, we do about 5 to 6 treatments in there every 6 to 8 weeks. We have gotten into the vitamin C, IV vitamin C therapies, which has a long list of application for one's wellness and health, as well as something like an acute illness. It really can knock down an infection quickly. So many things to be grateful for, and in this last year that we've brought on, and we're, again, of course, always looking to be that tip of the spear, to add more tools to the tool belt, and everybody responds differently to different things. So it's identifying that person's. We're the guide again when you come into Okoboji Wellness Clinic. Everybody is not where they want to be from a health and wellness perspective, or they are and they're wanting to prevent and optimize their health so they don't have problems 10 to 15 years down the road. But if you come in with 3 to 5 goals, brain fog, inflammation, pain, my energy is low, then we work on a game plan for you, and it may involve one or many of these different modalities that we have to offer. And then, looking backwards, Dave, all those amazing things in the new year, we'll bring on some more hope stories and some folks that have been touched by the results that we've seen here at the clinic. But looking forward, into the new year, we will continue to expand and add new pieces to the puzzle. One really, really exciting thing that will be coming this next year is a device that offers a larger volume of blood to be treated with ozone therapy, and it actually filters the blood as well. So they have actually found with this device the ability they're finding microplastics in it. Of course, we've become receptacles for microplastics that are in so many of our foods and storage containers and things like that. It will pull out many of the impurities of the blood and then ozonate that blood as well. And so those folks that are coming from a distance, it offers a little higher dose and treating more blood. So you don't do this particular ozone treatment as often. So there's a lot of times when folks come for IV ozone therapy, we do about 2 treatments a week. And many times we're aiming at least 10 to 15 treatments. So a lot of times we have folks come back and forth to get those treatments. But with this new approach that we'll be offering, not only will it filter the blood, but it will offer the potential to not have to be here for as many treatments.
A couple of things I want to talk about before we head out. We have talked a lot about medication, and you certainly do traditional pharmaceuticals when needed. But we have discovered that some people have an extraordinary amount of medications they're taking on a daily basis. And some of this is just like chasing your tail. They give you one, it has some side effects, they give you another, and that has some side effects, and they give you another. And then it was just eye-popping when I told you that number of medications that people that are in nursing homes that they take on a daily basis, just absolutely extraordinary. And one of the things that I think's been really cool, again, you certainly use traditional pharmaceuticals, but people that have worked with you, they have been able to lessen their pharmaceutical load.
Right. And I look at myself, again, as a bridge because I was trained in the traditional system, and I like to utilize the best of both worlds. I think there's some good in both worlds, and we want to focus on that. But that being said, I think it was Sir William Osler, he was the founder of Johns Hopkins, said the first duty of a physician is to not prescribe medicine. I think it's pretty ironic, but again, there's a time and a place for it. But unfortunately, if we're not getting to the root cause so often, or we're still intoxing, where the body is still being exposed to toxins, and we have an adjusted lifestyle, things like that, then it does make it a little bit more difficult to bring that body into that healing space and make it a little less dependent on pharmaceuticals. That being said, a bridge is an important place to be because so many folks over the last 3 to 4 years, again, are interested. They know that there's more than one way to go about solving a problem now, and so I'm always very pleased when I am able to safely lower someone's pharmaceutical load, and many times I will work on all these other areas to build the body up with oxygen, use these other treatments, hyperbarics, ozone, and it won't be sometimes until 3 to 6 months down the road until I start to wean off of some of these prescription medications. There's a specific way to go about doing it and a safe way to go about doing it. And I want to build up the body with these other means, with the lifestyle changes, the nutrition changes, what we're being exposed to that might be a toxin to the body, eliminate that, and then open up those detox pathways, get you on the right nutrients, the right supplements, oxygen therapy, and then the body does the work from there. And then the body has an innate tremendous capacity to heal. God made us as healing machines, and so sometimes we just got to kind of just get the formula just right, and then God takes over, that healing machine takes over. But who doesn't want to be on less medication? I mean,
right.
that's because a lot of times those medications are maybe serving a purpose of lowering blood pressure or lowering some risk in some area. But a lot of times folks outside of a heartburn medicine, which you can feel, oh, my heartburn's gone away on that heartburn medicine. But many medications that are taken, folks really don't notice any difference when they're on them versus off them, but their numbers on their blood work or their blood pressure shows the change. Whereas we want to actually have you feel different. We want to look at things physiologically, what's happening at an anatomic level. And if you are feeling different and you're feeling better, your energy's better, the chances are that you're going to have to be less reliant on these pharmaceuticals because your body is in a space of happiness. It's not crying for extra oxygen, and it's not saying I'm super inflamed with all this oxidative stress. So it's amazing to me, and it's kind of a slippery slope that folks can go down when they're searching for answers. Let's just add one more, and then there's one more pill that's going after the side effects to eliminate the side effects of that other pill. So you're spot on, Dave, but just remember this is a journey, and I love it when folks are involved in their own care and they're researching things on their own, and they're coming up with ideas, and because it's truly we're a guide here, and we have some good education and good thoughts and great paths forward, but it's the person that's living in their own self that knows themselves the best. And if they take some interest into going into and some ownership into their own path, many times they can lead the provider to the answer, which
right.
is pretty cool.
Now, listen, we're out of time. A topic I want to cover down the road, though, is psychiatric drugs. I've been doing a lot of research on those, benzos and SSRIs, and I know a tremendous percentage of Americans are on a benzo or SSRI or both. And one of the things that I don't think probably gets told enough when one goes down that road, how difficult it is to come off of some of those drugs. And I would love to cover that topic with you.
Let's do it. Yeah, 2026. That's a big one, and that is something that's going to tie back into the microbiome and gut in a big way as well. But you're absolutely right. To wean off some of those anxiolytics meds for anxiety, depression are more difficult than others to come off of. So it's an important topic. And then I'd also like to kind of dig back into, because I live in this world every day. It's not new to me now, but it's still surprising to me how many folks still don't know the good news of all these different, what does hyperbarics do? What does ozone do? And so I'll be touching in the 2026 on all of the different areas and modalities, and kind of do some refreshers on what and why for each of these modalities, as well bringing in some members of the Okoboji Wellness Clinic team to share a little bit of what their experiences here. We've brought Michael on and Molly on occasion, but I'd like to do some more of that as well.
Very good. Love the motto, thrive, not just survive. Live the day, just don't make it through the day. For those that are looking to thrive, looking to live the day, Dr. Meyer, what's the best way to get a hold of you?
Yeah, give us a call at 712-339-6024. We're at 3305 Berquist Avenue, Spirit Lake, Iowa, just off Highway 71. We do the discovery calls, complimentary, 15 minutes, and that is a chance to ask a few questions and let us have a little idea of the direction maybe you're wanting to head, and seeing if we can accomplish some things together. The initial visit is typically about an hour long with me. We like to take our time and really get to the root and go back and do some detective work, so then we can know how best to set you up for the path that you want to be on to thrive in 2026.
Very good. Dr. Meyer, to you, your family, the entire team at Okoboji Wellness Clinic, a very happy new year. Hopefully it's a very blessed new year for you, your family, Okoboji Wellness team. We'll talk to you next week.
Okay. Grateful for all you out there. Take care.
Thank you, Doctor. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.